Hey everyone, Collin at Optimum Therapies. I'm here with the first part of a three-part series on chronic pain and how we treat chronic pain here at Optimum Therapies. First of all, we got to define what it is, chronic pain versus acute pain. Acute pain is anything that has come on within the last 3 months. And the simple definition of chronic pain is anything that has been lasting more than 3 months. When we dive a little deeper in that, there's different types of pain. So of course you've heard of nerve pain, there's joint pain, there's pain from swelling in ligaments and the tendons and the muscles. All of those pains they feel a little different, and it may depend too on how long you've dealt with that type of pain. So my favorite way that I've learned to describe pain is that pain is an experience that we experience. So like with any other experience in life, the way you respond to that is going to be a little bit dependent on what you've experienced before in your life. So if you've had experiences in your life of major injury or major trauma, car accidents, broken leg, something like that, you may respond differently to sciatic pain down your leg than someone that's never had major injuries to their legs before. Maybe it's the first time they were experiencing that kind of pain. So if you've also been under a lot of mental stress lately, that is weighing on your brain's ability to experience that pain. And you're going to respond a little differently to that too. Ultimately, that also means you're going to respond differently to therapies that we try. So if we're too intense with exercise or we're too intense with our manual therapy, that's going to affect some people differently than others. So here at Optimum Therapies, what we like to do is really get to know the person and their past experiences and incorporate some of that into their rehab, especially when it comes to chronic pain. But even that acute pain response is going to be different from person to person. So stay tuned. The next series, or the next part of this, the second part is going to be about defining the different parts of chronic pain or types of chronic pain. And we're going to dive in a little bit of how we approach the assessment and making a treatment plan for those people. So stay tuned.